Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of what I call the Common Sense MD. Today I've got probably one of the most unusual and interesting people that I know. We've been friends for a long time, Dr. Scott Fitzpatrick over here to my right. And he's been doing acupuncture medicine for many years, and he does a ton of other stuff. That's why I want to get into some of the stuff you've been into. It's just incredible what you do. You've worked on me. You've worked on my family. You've worked on my patients. Yep. You always do a wonderful job, and it's almost like I send you the hardest patients as well. Yes. I never send anything really easy to you.
No.
I know you get a lot of last resort patients like I do.
That's right.
Before we get into all that about acupuncture, you know, I knew you as a high school baseball player.
That's right.
And you were quite a good baseball player. Now you're a guitarist. You're a guitarist and a mandolin player.
Mandolinist, yes.
But it's incredible how talented you are. Tell me about baseball first.
Well, I'll tell you, all those talents a lot of it comes from my ADHD, which keeps me really in need of something new. But yeah, so I played baseball here, you know, and then I was very fortunate. I went up and played Division I baseball at Western Kentucky. Okay. So I was at Western Kentucky University for a couple of years, played there. Moved back to East Tennessee, where I taught high school biology and coached baseball, and I did that for 5 years. But I really always want to be in medicine. And one of my pediatrician here, who I know is an old friend of yours, I was always inspired by him, and I thought he was just fabulous, and always had that urge to do something a little more challenging. And then one of our dearest friends, Dr. Dan Kleiner, who sadly is no longer with us. You know,
wonderful guy.
One of my most favorite people, and a true mentor for me. And he actually encouraged me to go study Chinese medicine and acupuncture, because he told me in 1998 that when I asked him about going to medical school, I said, but I don't want to go and be an MD. I don't want to be a Western medical physician. I want to try acupuncture. And he said, and he looked at me and goes, you know, Scooter, you know, he'd look over you like this. He goes, you know, that's the next big thing. And I said, why do you think that is? And he said, well, you know, we have a problem in America with opiates. And right now we're seeing these people come back post-surgically with all of these problems and side effects from opiates that they were telling us these, you know, they're not addictive, et cetera, et cetera, et cetera. Yeah. So that was in 1998, way before, you know, the epidemic really took over. So I applied to the #1 Chinese medical school in the United States, which is in Houston, Texas. And my whole desire was to go down there and do sports medicine, you know, because of my history with baseball. And I swear to you, as soon as I got into the program and started seeing day-to-day things, you know, everything shifted completely. So I thought, you know, I can do sports medicine kind of in my sleep, but I want to do some other things, you know, and be a lot more, I guess, well-versed and, you know, a lot more broad in my scope of practice. So, you know, that was 20, and I've been here now, you know, working with you for 24 years now.
You have a great reputation, and your demeanor and your calmness, maybe it comes from the Chinese training, but is just so much different than the Western idea of medicine. You know, I'm here as kind of a cash-based practice, kind of an outlier that I've been for the last 20 years in my practice. Mm-hmm. You know, I can really appreciate somebody like you more than probably somebody that does stuff a little bit outside the box, that actually is focused on helping people and not enriching insurance companies. Right. And so I'll rail about that a lot. And you're the perfect person and example for somebody that really does it for the right reasons. And you do such wonderful things with acupuncture. You know, the first time you stuck needles in my back, as you know, I have a rather bad back.
Oh, yeah.
You know, I thought this is going to hurt, but I didn't feel a thing until you started running a little bit of current.
Current, yes.
And it was a pleasant feeling, not a painful feeling. But so you did all this training. You came back here, and you built up a huge practice.
Huge, yeah.
Tell me a little bit about acupuncture, you know, how it works, what type of patients you like to see. You've worked with some of my migrainers.
Oh, sure.
And, you know, anywhere from stress to pain. It seems like most people that come to me are either hurt or they're tired.
Yeah.
And those are the two major things that baby boomers experience.
They sure are. Yeah. And I appreciate you saying that. I have, when I first moved back here, most of our training in Houston was done back in the late 90s and early 2000s when MD Anderson was pumping people full of chemotherapy medications. So for the first couple of years of my training, that's pretty much all we saw. We saw the sequel of these chemotherapy medications, radiation therapies, and surgeries for in oncological patients. And moving back here, that's kind of how it started. And that's how I kind of got in with I've been actually adjunct faculty at the medical school here for 22 years now. So I precept for all the family medicine residents that come through there. And I kind of tell them this same thing because it's really important. Western medicine back then has done such a great job of evolving and learning how to dose those medications better. It's been 15 years, I bet you, since I've had to treat somebody with nausea. Since I've had somebody come and say, my neuropathy is getting worse in these things. So that was kind of my initial foray into the medicine. And then the easy stuff, because people didn't know what to send me yet. It was always an arthritic knee or an arthritic shoulder, something like that. And now it's evolved and people are getting a little better understanding of what I do. I get all the stuff that a lot of people don't want to see. Yeah. The pain stuff and when I have other doctors like you, and I've got to give you credit for coming and just following me for a week or 2 weeks or whatever it was years and years ago.
A long time ago. Yeah,
just to get an idea of this cash-based practices and how we develop patients. People typically come to see me the first encounter as a last resort. Because they've had every kind of Botox, they've had every kind for migraine headaches, or they've had every kind of medication for blood pressure, or they've taken everything they can take for neuropathy that's idiopathic or whatever it may be. But that's the first time, and then it seems like after that they come to me first.
Yep.
Because and the understanding is I still have hundreds of hundreds of Western medical physicians, PAs, nurse practitioners that I will absolutely call or text and say, hey, listen, this guy needs an EKG or that gal needs an MRI. So it's just about integration and it's about, losing ego long enough to hear what that person's telling you. And that's what I try to do.
Most doctors would do that. Lose the ego.
Oh man, just lose it.
And listen to your patient.
And listen, they're telling you what's wrong with you. It's your job to interpret that.
Yeah, you're exactly right.
It really is. They're telling you, and at some point in time, you got to put the computer, the laptop down, and stop worrying about billing and coding, and go, golly, what'd you just say? Can you say that again? Because it seems like something we're missing. So that's kind of where I am now. It's been it's really an interesting kind of path that I've taken, but it's certainly now I see all the ones that just people don't want to see, the complicated headaches, the complicated post-surgical things like RSDs and CRPSs, the reflex sympathetic dystrophies, things things that are just tough that most people in medicine do not see if they're not in either neurology or pain medicine. Yeah,
they don't have the knowledge or really the time to treat it. Just throw you on another pill.
Yeah, it's tough. And then you'll get. But thankfully, we have such a great network here of people that do trust me and they'll call and say, hey, do you treat trigeminal neuralgia? Yeah, well, I got one for you. And so it's been a long time coming, but. It's been a lot of.
Tell me the basics of how acupuncture works. We've gone over it before, but just for the audience,
sure.
Give me the simplest way you can get across why it works, because it does work.
Simple,
There's no doubt about it.
The super simple, and the honest truth is, we put little needles into spots all over the body, and those little needles are nothing more than noxious stimulants. When they go in, your body says, "Wait a minute, what's going on here?" And the blood starts to flow. So we get all just this whole cascade of things going on inside your body. You put enough needles in the right spot, then the brain really starts to say, wait a minute, something must be wrong with the left shoulder. And that's the basis of how I treat it. There are theories about meridians and channels and all these things that really do work too. And I don't talk about those a lot just because they're not as easy to define. But if you think about it, the channels and the meridians and things they named 1,000 years ago, and they run really along similar pathways as the lymphatic system. You know, they're kind of in 3 dimensions. They're not real linear, like a big humerus or big femur. So it's kind of a little fascia-like and kind of lymphatic, like where it dips and kind of moves in and out.
Nobody talks about fascia, do they?
Oh my gosh, Tom!
We could talk for 3 hours.
We could talk for 3 hours. I just had just a conversation just a bit ago. This person had an injury to his shoulder. Is a first responder. Had a surgery. Didn't go so well. But now there's this whole thing about the memory of the injury and the post-surgical pain and this thing not healing. And it's a whole lot more than just going in there and putting someone through some range of motion stuff and strengthening stuff.
Oh, for sure.
You've got to work that fascia, because the fascia, again, it's being this 3-dimensional thing that has such an intricate weave of nerves and vascularization it's really kind of at the core. I think it's the biggest group of nerves and sensors in the body.
I agree 100%.
Yeah,
with you.
and
That's why if you get a deep tissue myofascial release, it works.
It works. Well, and that's why, a lot of this osteopathic medicine. So what, and again, what I do, stick those little needles in there, is just how we start the body to communicate. And I'm sorry, I kind of got off the rails a second. You'll hear dry needling and you'll hear electric acupuncture. The big difference is the dry needling. You'll hear physical therapists do it, and a lot of osteopaths do it. They'll actually go into the motor points of a muscle, lift and thrust, and they'll kind of twist the needle because the little muscle fibers will turn around that needle, and they're just stretching and pulling. And it can work. It can be a little uncomfortable. I don't do that because I like to use electrical stimulation, because if I can get that little needle into that muscle just right and put just a little bit of current in there, it not only stimulates the muscle, but it also starts turning loose of endogenous opioids in your brain. So you'll get an increase in serotonin, an increase in oxytocin, and these natural occurring painkillers in your body. And that's why people get up going, golly, I feel kind of good all over. And that's the big difference between what I do with electric versus dry needling.
I've had both, and certainly yours is a lot less painful than the dry needling. Yeah. Not that the dry needling doesn't work. It does work, but
it's different. It's a different approach.
I think what you do is more potent for sure.
Yep.
Are you telling me that through these needles that it really can release your body's own healing powers in a way?
Natural hormones, natural, and the biggest thing is serotonin. We stimulate a lot of serotonin in the gut, but also in the spine. So, and we do that with that electric acupuncture. Now, the weird thing is, like, we have Parkinsonian patients, but the acupuncture doesn't. Electric acupuncture specifically does not stimulate dopamine. Don't know why. It just doesn't. So, but I tell people we can't stimulate dopamine, but we can still work on tremors and pain associated. But that's why I see a lot of patients with these really complicated pain syndromes that are associated to emotions and associated to trauma, and those are really tough. Really, really tough. And those are the people and I have people thank me regularly for taking extra time, but I tell them, I can do this because I have a staff. My staff takes care of things, and they know if I'm taking longer with someone, it's because they need it. They have people like you walk in and say, "Hey, man, do it on my back again," and you lay down and go, "Good," because I'm behind.
I've done that to him many times.
That's right. Hey, if the smoke starts coming out of yours, I know that's too much electricity.
But you are exactly right about that, because a lot of times when I'm seeing a difficult patient, and I can't really figure them out, but I know there's something they're not telling me. So I say, talk to me about any trauma you've had or anything like that. And then the tears start coming. And there's some welled up childhood trauma. So in my opinion, if you can't get to the root of the problem, then you're going to help them out a lot more if you can. And sometimes it's difficult. It's time consuming. People think we're not psychiatrists or psychologists, but in a way we are.
We are,
there's no doubt. You can't deny that. So a lot of times I think just getting that trauma and telling somebody about it, it helps. And then you give them some good advice, and the mind and the body work together. Everything's connected.
It is.
And your brain is so powerful.
It's so powerful, and I truly believe that connection, that fascia. If you'll ever have him back, we'll come have a fascia talk one day. But I really think that fascia, when there's a traumatic injury, for instance, let's just say I know of a guy that had a headache for 40 years. He was hit in the head by his mom with a cast iron skillet. She had some schizophrenic problems. She used to beat him, and one time she whacked him in the head with a cast iron skillet.
And so the emotional trauma of that
held on to that forever.
That is so interesting.
But thankfully we broke it. Well, we broke it.
How do you get better?
We broke it. And a lot of times it's just and I'm going to speak. If people don't know you very well, I'm just going to help them understand you. When people come into your office, they feel safe. And that's the key. When people come into my office, they feel safe. They can be anybody they are. They can say anything they want, and they know that there's not going to be any kind of judgment whatsoever. And that's just the way I've always been. I'm very fortunate to be like that. And being able to first give people that safety. I have a lot of veterans.
Mm-hmm. You treat a lot of veterans.
Yeah,
I know from the VA, they send them to you.
Shoot, yeah,
by
Tom,
the dozens.
Yeah, for I bet you for 8 years before there was a change in third party reimbursement, which I don't even want to go there. I was the number one outpatient provider for the VA in this whole southeastern region.
Oh, I can believe it.
And I mean, I saw thousands of those soldiers, and it was incredible, the stories and the time. But I always loved the guys that I would go into, and they'd be sitting there going, "Why'd they send me over here for you stick needles in me and electrocute me? How's that going to help me?" Yeah, or the soldier, could be male, could be female, that would have had a traumatic experience with a male doctor or male superior, and you have to give them that space and start working that out. And once you start to do that, you start to see them let go of this energy and this memory, and that fascia starts to let go a little bit, and then hopefully a couple well-placed needles and just the right amount of stim.
You have so much skill with these needles. I mean, how long did that take you to feel confident in placing these needles with the knowledge of where these meridians and all that? It took years. It had to.
almost 29 years now. It seems it's every single day still to this point. I'm just so conscious about everything. Not just where the needle goes, or not just the stimulation, but just the comfort of the patient, physically, mentally. If you came in to see me and your back, if you came in to see me and your back hurt, and I threw you down the table and put a bunch of needles in there and put some stim on you and walked out, and I didn't realize that you'd hurt your back, picking up your dog that was had broken his leg or something, and it was an emotional day. That's a whole lot different than you saying, "Hey man, I was stepped in my car and slipped on ice." That's a whole different story.
Yeah.
Then I just say, lay down, you'll be fine.
That is so interesting.
So I do that. So every day, but the needle technique is huge. The one thing I see in a lot of the physicians that I treat or train is their inability to palpate. So I teach them how to find sore spots, how to find where there's limitations in movement, and then how to get a needle in somebody without hurting them.
Doctors these days do not put their hands on many patients. So, we learned all these skills in medical school and residency, and because we have MRIs, we have CAT scans. Nobody ever touches the patient, and you really do need to palpate. And you get a good palpation's worth. It's better than a certain CT scans, isn't it?
It's far better, and a lot of times if the insurance companies would trust you to do those things, you could probably save them a bunch of money by saying, you know what, this person doesn't really need a CT. They really don't need an X-ray. They really don't need an MR. They got a muscle strain. Well, we're going to put them on some yoga stretches or send them up to PT or send them over to see Scott or whatever, and that would save.
Can you imagine?
A lot of money. Oh gosh, no. But the patients would do so much better.
They would,
because then they'd be like, shoot, my doctor didn't even look at his computer the whole time he was in there today.
Yep.
I tell you, honestly, one of the other main reasons I went into medicine was because I'll never forget when laptops started coming in, and I went in. I'd just become an adult. Just got my first biology job and had to go for a physical or whatever. And the doctor's sitting there on his laptop clicking. He'd look over me like this and go,
yeah.
And anything, and then he hit send, and well, there's your prescription. I'm like, for what?
That's the way it's done. That's why I don't do that.
No,
I don't
know.
do computers in my room. I do paper charts, just like my dad did them.
Yep.
60, 80 years ago.
Yep.
But so it's a way better brand of medicine. Also, you don't have that juggernaut of the, order this test, order that test, this drug. Not that we don't have great drugs out there for certain things,
and great tests,
and
if
MRIs
needed.
for certain things,
needed,
but not. It's way overused because it gets into the cycle of money generation. And it's just kind of.
Well, and then I think going back to your dad, then we really get out of, and what upsets me the most is taking away your brilliance and your experience and saying, hey, we're sorry, Dr. Blank, but, we're still going to do this, but her thyroid's not right. It's in range, but it's not right. Well, but, we can't approve that medication or low testosterone.
That's
God,
exactly.
how many times have we seen this? Like,
a million.
Golly, they say it's within range. And then you and I have to go back and unwind this every day. Yeah, we have to go back and unwind this memory of these patients that say, "But my doctor told me it must be okay." Then we've got to unwind that script
I talk
all
about
day long.
cognitive dissonance in my practice all the time, and doctors are the worst for that.
Yep.
Well, something they learned 30 years ago. That's the way we do it. That's the way I learned. I won't learn new stuff or open my mind to different treatments that may work way better. And so it's crazy. But anyways, at least there's a few of us out there doing this. I hope there's going to be more.
There are.
Now, let me ask you, you call this electro acupuncture now.
Yep.
When did they start doing electricity with it?
That's a good question. I've heard it a bunch. Obviously, certainly when they started having electricity, why somebody put electricity on a needle, not real sure, but I will tell you a couple of really interesting things. The acupuncture points that I use are exactly the same as you would have if you had an EMG. The exact same points. So if you go to your neurologist, let's say your primary care doctor is concerned about a neuropathy or radiculopathy, whatever, and they say you need an EMG.
Which are painful.
Painful. Heck yeah. And they're the exact same points I use. The research has proven that they work. The difference is they use for diagnostics and I use for therapeutics. They're hitting with a massive short dose, pow, to measure, how long it takes an impulse to get from A to B. Where I'm doing it to soothe those muscles and to stimulate natural, hormones in your body to make you feel better. So so I don't know the perfect answer, but it's not been super long.
I kind of correlate it to when Bob Dylan back in 1965 we're sitting along all these guitars, these electric guitars. He went electric in 65, made a lot of people mad because he was a folk acoustic.
Yep.
You see the movie? It's a great movie.
Not yet, but I want to see it because it's really crazy.
So when he went electric acupuncture, I would say it's about the same time.
About the
it
same
became
time.
more famous, so it's just better.
Yep. I love it.
So we know these. We kind of know how it works and what it does in a simplified form. Tell me a little bit before we leave here about this podcast you've been doing for 20 years called Weird Medicine.
Weird Medicine.
You should listen to his podcast. It's incredible, the weird stories. And he's been doing it for 20 years.
Yep. So about 20 years ago, my buddy Dr. Steve, who you also know, is he is one of the kindest, most loving people I've ever known. His mom had a terrible end of life experience, and he said, "I'm not going to let that happen to anybody else." So he kind of like you, he jumped out of family medicine and went into hospice palliative care medicine. And it was about that time, podcasts and things were starting to kind of become, kind of part of the norm. And he was listening to like Howard Stern or someone. And he called in because there was another doctor on there that had said something that was inaccurate. He's like, "Hey, listen, I know you don't know me, but I'm blah, 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 and this is wrong, and this is what they should have done." And they called him back. Said, "Hey, man, would you be interested in doing a show?" So Steve started this show on Sirius XM radio called Weird Medicine with Dr. Steve, and I've been his sidekick for 20 years. And man, what a ride it is. We do some weird medicine. People, if you've got something strange or odd, we have covered it, and if we've not covered it, we'd be happy to talk about it.
I love that. You should tune into that show.
It's a lot of fun.
20 years of weekly shows.
Yep.
I've been doing this podcast for 8 years every week. 20 years is a long time.
Yes, yeah, Dr. Rogers, and we were doing podcast and Sirius XM radio shows both, and it was just taking a whole lot of time. So we've pared that back. we're kind of blending them together now. So you'll hear a little bit of the same stories, but yeah, it's a lot of work. I don't think a lot of folks, understand, especially when it's a kind of a professionally done deal. We record for Sirius XM. We do it right here in the hometown, up in his third floor. We're not in your third floor. We're in the basement.
Speaking of, this is my guitar room where I play a little music.
Which we're getting ready to break one out in a minute.
And
you
play music as well. You play mandolin, guitar. You're just a natural musician too.
I don't know about natural music, but I'm very fortunate. I picked it up really, really quickly, and not that I'm any good, but it's honestly, I think music is good for your soul.
Oh, there's no doubt.
It's very healing, and we may not be good, but we're entertaining.
I think it helps prevent dementia. It really does.
I think the dementia thing helps. I think just socially.
Yeah.
Socially, sitting around with your friends, making some racket, and next thing you know, you get to be where you're not bad, and other people start going,
next thing you know, you're on stage and these women are throwing
throwing stuff
underwear at you. Is that what happens?
Yeah, pretty much. That happens all the time. They're throwing things at me, but it's not. Yeah, it's not good things. But,
that reminds me of something I heard the other day. The statement, "An apple a day keeps the doctor away." Here's a new take on that. An apple a day keeps the doctor away, but only if you throw it at him.
That's the truth, isn't it anymore? I tell you, and some of them should get an apple thrown at them so they'll start paying attention. Just to wake them, just to get them out of that cobweb.
Well, I love the way you practice medicine.
I mean,
you've helped so many of my patients. You've helped me. Oh. You're so kind. You're so knowledgeable, and Dr. Scott Fitzpatrick, thank you so much. We're going to do another one.
Thank you, Dr. Rogers.
Talk about fascia.
Yep. Yes, please. I would love to do that. That would make me happy. So we'll do that next.
Thank you, Scott.
All right,
appreciate
buddy.
it.
Appreciate
See you guys next week.
Thank you. Thank you very much.